to LexMedia's coverage on the COVID-19 and coronavirus pandemic. And today we are going to be joined, I'm Colleen Smith, I'm a volunteer with LexMedia, and I'm so happy to be joined with Wendy Heiger Bernays, who is the chair of the Lexington Board of Health. Welcome, Wendy.
Thank you very much, and thank you for having me.
And we also have Dr. David Geller, who is a pediatrician and at the Bedford Pediatrics. Is that correct, Dr. Geller?
Happy to be here. No,
and you are also as well on the Board of Health.
Yes, I am, with a great group of people.
So I thought we would maybe start out with both of you just giving you a little bit of background about yourselves and how you became to be, I think one of the things that a lot of people don't know is that the Board of Health Commission is, it's a appointed, it's not an elected position, is that correct?
That's correct.
Okay, so why don't you talk a little bit about your backgrounds and how you became involved in the Lexington Board of Health? Wendy,
sure. You want me to start?
Sure.
Wow. Okay. So I have been on the Lexington Board of Health now for, I can't actually recall the exact number of years. This is my, it must be 15 years because it's the way the appointment works. I started out on the Board of Health many years ago when Bert Perlmutter was chair of the Board of Health, and Dr. Perlmutter is still on the board. I became interested in serving on the Board of Health because I happened to be walking down Mass Ave one day in the center of town, and the health director at the time, Beverly Anderson, tapped me on the shoulder and said, "Professor Heiger Bernays." And I looked over, and it was Beverly, who had been a student of mine. She was health director of the Lexington Health Office at the time. And she asked me if I would consider serving on the Board of Health. And I said, absolutely. And that's when I started. But I serve in part because my day job, I'm a professor of public health at the Boston University School of Public Health. I train Masters of Public Health students and doctoral students in environmental health, and all the things that we see go on in local public health is what I teach in my courses. And so I'm extremely proud to have, over the years, many of the health directors that are appointed or who are working in the state of Massachusetts are my students. I work very closely with a number of state organizations, including folks at the Massachusetts Department of Public Health and Department of Environmental Protection. And these two agencies give us really the mandates for what we do in the Board of Health. So I both teach environmental health and public health, and my research portfolio is on a number of the exposures that we experience that are associated with illness. And so I bring my day job to my night job and my night job to my day job.
So you bring a wealth of knowledge. I mean, who would have thought in this situation, how important your background and experience has been to help in this pandemic currently?
Yeah. Well, you sort of hope, well, with public health, we say, when it's working, you never know it's working, right? Until there is an issue, such as, it doesn't have to be a pandemic, it can be a variety of other things, where we see that the public health system really is challenged.
Mm-hmm. And David, maybe you could share a little bit more about your background and your position on the Board of Health as well.
Yeah, I appreciate this. So my wife and I moved to Lexington back in 1996. And that's when I started a job at a local pediatric office, and that was actually initially in Lexington, and now it's in Bedford. And I've been involved in the community in that way initially, and knowing Wendy professionally and personally, and she asked me, I forget how many years ago, to be on the Board of Health. There was a vacancy coming up, and I really thought it was a great way for me to get more involved with the community. And I didn't really realize it as much, but a way to give back, to what the community has given to me, and to be more involved in that way. And for me, it serves many purposes. One, again, having that involvement, bringing my, I guess my knowledge base to the group. But also two things. One, it's a great way for me just to decompress on some days, to be part of this group, just kind of thinking about stuff that I'm not dealing with, maybe on the forefront every day, maybe a little different, perspective. And also I've learned so much about what, public health and the needs of the community, from simple things, just as, permitting, food establishments, and dealing with dog poop, and dealing with issues like the PCBs at Estabrook School, and the current situation. But being in the presence of people, not to build her up too much, like Wendy, who is really an expert on many public health topics. I mean, this is her day job as well, and to learn so much from her, to know that the topics that we're discussing are papers that she's written about, topics like that. So to me, it's just been an amazing augmentation to what I do on a daily basis.
Okay, well, thank you. And David, I know you have a podcast that you have on with LexMedia that you also called What Do We Know? And in preparing for this interview, I actually listened to your podcast with Wendy, and it's pretty remarkable when you think that was on March 20th, and what you were discussing on that podcast and where we are today on May 4th, and the significant changes that have happened. Back then, you were talking about the potentials of the schools. When would they be closing? And, now we know at this point that, they're closed for the remainder of the school year. But I thought maybe we could just talk about, because things have changed so much, where we are today, and more about the Board of Health. I know on Friday they had testing here in Lexington. Maybe you could share a little bit about where we are with, I don't know if you could talk about confirmed cases and where people can go to find out more information about testing and where we are with cases. Could you share a little bit about that?
Sure. So the way this works is, the ability to get tested. There are a couple of varieties of tests. The test that you hear everybody talking about is the nasal, the swab that gets stuck up like to your brain. Something not quite like that. And it's what is being looked for on that swab is viral genetic material, right? And so that the presence of that genetic material confirms that the person tests positive. So up until very recently, the criteria for testing were quite restrictive in that, frontline clinical workers, medical workers could be tested. Essential personnel in supermarkets, et cetera, could be tested, but you really needed to be symptomatic. With the availability of tests, that is loosening up, and the criteria for testing are becoming more relaxed in that you don't have to be a frontline worker to be tested. But there still is, an emphasis on being symptomatic, actually being ill to be able to be tested. And so we get an update. The health director gets the update daily from the state on the number of confirmed cases. The caseload is then shared with the public health nurse and the health director, who then start their processes of following up with the cases, the person who is testing positive, and then following up with them doing something called contact tracing, which is working with them to figure out who they have been in contact with for the past week or so. Mm-hmm. So every day we get a case count, and the cases are increasing, both because the testing frequency is increasing. We actually don't know exactly how many tests are done. The state does not give us that information. But we also learn the number of cases. And so then that is reported. But now the state has been providing even more useful information, which is called a case rate, right? Which is the number of cases over a period of time per 100,000 people, which actually allows us to sort of compare rates across jurisdictions or cities and towns. And that's reported on a weekly basis by the State Department of Public Health. So from January 1st through April 29th, which was when we got the last report on the cases, and every Wednesday it seems that the state will release the rate, right? Because that's really the number that is meaningful. The case rate for Lexington is 754, which is 754 cases per 100,000 people, right? Or the number of cases, 257 cases per 100,000 people. And so that gives us the case rate, and we are higher than Arlington. We are lower than Bedford. Those data are publicly available, so people can go see that for themselves.
And I know the town of Lexington tries to stay updated with information for people can go on the town website.
Exactly. Yeah. Because people want to know. And I think some of the challenges, and it may seem like we're hiding something. The challenges are, the absolute number, is not really meaningful if you don't know how many people were tested. Mm-hmm. You don't know how reliable the testing is. Mm-hmm. And so just having the number, it doesn't really help you. Like if I were living on the border of Lexington and Bedford, for example, like David lives very close, right? If people across the street from him were diagnosed as cases and they're in Bedford, they wouldn't appear in the Lexington numbers, right? Mm-hmm. So it's very helpful to understand what those numbers actually mean.
Mm-hmm, mm-hmm. And I think, again, when you were talking on the podcast in March, where we are today with testing, with increased testing, and also this contact tracing and the antibody tests, which I know I wanted to ask a little bit about that. It's so significantly different where we come in 6 weeks. So, and obviously the more tests, the more numbers. And I know in the paper today, I think Middlesex is still, I think the highest with over 15,000 cases, I believe. David, maybe you could talk a little bit about your, in what you see as a pediatrician, with children. I know, and I want to talk more about the schools as well, but what are you seeing with children with cases, but not only just that impact, what other impacts, emotional impacts, and what are you seeing this is having on the children today?
That's a great question. It's a loaded question because
that's why she's so good.
having 3 children of my own, 2 college students and a 3rd grader. That's one perspective, and as a parent, and then there's the pediatrician aspect of what we're seeing in the office. So I'll try to break it down in terms of the physical. I mean, there's a lot of, as Wendy mentioned, a lot of people that we just assumed had this initially, but we didn't test them because of the availability of the testing and the indications. And so we don't know really how many people had it or kids had it, although we assume a lot did. And then there's the information did get it, and they often went as sick as an adult who got it, but there still were kids who were getting it and getting pretty sick. So we don't really know the numbers. So there's a lot of phone about their children who had symptoms initially that we felt were consistent with COVID-19, but we just didn't see them because they weren't that sick and they weren't a high risk factor. Mm-hmm. That, if you think back to the podcast of 2 months ago, with the criteria that we were using for who might be sick, recent travel, high fever, respiratory symptoms, those much evolving. All this evolved over the past 2 months to a much more global symptom list. It could be headaches or muscle aches. It could be fatigue. There's this talk of these COVID toes now that we're seeing, these big rashes on the toes, unexplained. So it evolved from like 3 to 4 symptoms to a multitude. So in terms of what we see, there's a lot of kids who probably were sick, but we didn't see too many kids who were extremely sick. care of them, which is great.
Mm-hmm.
Emotional toll, or the behavioral toll is interesting as well, because I think one of your next guests should be a local teacher on here in terms of how they're dealing with these kids. If not a parent, how we're trying to teach our kids at home. There's an increased level of stress, a little increased level of inattention probably. There's some heightened anxiety among kids as well. There's the feeling of loss, right? Whether you're a third grader who's not seeing their class anymore, or the high school senior or college senior, or college student who no longer has that environment. And I could talk about this for a long time, but I won't. But the college kids are extremely interesting, because these are kids who were autonomous, in a school or college location, and now they're plunked back home with their family. Not that they don't mind being there, but it was a quick transition. So there's a lot of layers here, whether it's physical or emotional, that we're dealing with, both in the office and in our own houses.
Yeah, definitely. I have a daughter that's a senior in high school, and we're going through the same thing here.
Yeah, and I'm seeing some of the undergrads that I teach. It's really challenging, right? It's throw them something completely new. And I think the mental health, one piece of public health is actually mental health. And it's not something that has really been given the due that it should have been. There are pockets. We certainly work with colleagues in the public health world on mental health. And I think this is really going to push it into the forefront. I do want to mention that, there are many folks in the public health world who are trained in either mental health or in social work. Actually, our health director has a degree in both social work and in public health. And I think that recognizing that it's the whole human, right, as opposed to just the toes or the teeth or the whatever, but it's the whole package.
Yeah. So thank you both for that. I think it's very helpful, and it's a really good suggestion. I will definitely reach out, and we should have an interview with maybe a teacher, a parent, and a psychologist would be, I think, a great next call. So I wanted to talk a little bit about it within Lexington, and with the social distancing, again, where we've come the past couple weeks, and how, with the school closures, with many of the businesses being closed. And then I think you had a Board of Health meeting on Friday.
Oh boy, did we have a meeting.
Maybe you could share a little bit about what happened at that meeting. And do you think that all these things that have been happening and that Lexington residents have been doing, do you think it's helping to flatten the curve?
I'm going to start with one piece of that question about which was Friday's meeting. That was a very long meeting. I had mixed feelings, right, about the meeting. On the one hand, we spent a long time discussing, should we recommend the wearing of face coverings or masks? Where should we do that, indoors or outdoors? What does the science tell us about the utility of this as a means to decrease exposure of others to the virus if we are asymptomatic, or even if we're just slightly symptomatic and we cough or sneeze? What do we know about the science? Because that should really drive what we do. And then we overlay all the stuff about people, right? Which is, some of it's irrational, some of it's not so rational, some of it's very challenging. So we had this meeting and we deliberated for quite a long time. But I think the really good thing is that people see that we really think long and hard about the work that we do and the decisions that we have to make. And we take our charge very seriously, which is really to protect the health of the people in Lexington. So, and we also have to go with what we know about the science and the practicality. And we had the chief of police on, and the fire chief, and we had 70-something residents on the Zoom call. And we heard from a number of them, and they were all extremely thoughtful and extremely concerned. And in the end, we did adopt an order by the Board of Health is legally mandated, right? And legally empowered, if you will, to, you know, to make stuff happen. And we did adopt an order to require masks indoors. We extended it to all businesses. And of course, 20 minutes later, the governor did the same thing, right? So, and what we've been seeing is that the local municipalities are stepping up to do what has to be done, and thinking long and hard about what do we have the legal authority to do it? Do we have the science behind us? Do we have the mechanism to really make these changes, like closing schools and requiring masks and, you know, a number of other initiatives? And then the governor, the state, steps in and makes these same decisions. So we see, you know, a number of communities, 4, 5, 6 of them, and then the state comes in and does it, right? And it's a process. So we are going to, and we're going to see this roll out as we move forward. Governor's order extends to May 18th. Does that mean on May 18th everything's open? I don't think so. I think we're going to have to see where we fall in regard to the governor's order, and then make decisions for our community and make them in a very thoughtful, data-driven way that will protect the people as best we can. I mean, short of putting people back in their homes with no exposure to anyone else, you know, it's not a sure thing.
David, do you have any other insight into that, or your experience at the meeting, or?
No, I think, you know, going back to how I started out, I really think it is so much value to the board, and to the experience that different people bring to it, whether it's Jay Flynn, you know, and Bert Perlmutter, and of course Wendy, and our director Carrie. I mean, I think that, you know, we get it, maybe because of what we do also professionally, is that we get people's concerns, you know, and we get people's feelings and emotions behind this. And I get all the time, and people ask me, I was asked on one of the podcasts by my cohort, Dan, you know, what's the craziest question I get in the office? And I say, my first response, not to be, you know, politically correct, is, you know, they're all good questions. You know, parents are parents and they care about their kids, and I share their desire to keep their kids healthy. So there's no silly question, right? It's trite, but it's true. You know, if there were silly questions, then maybe when questions, and what do you need me for? So as Wendy says, I mean, this is emotional. People want to stay healthy. People want to do the right thing. People don't want to do the wrong thing. And I think this meeting was interesting all along, that people get that the community gets that we think about this, and we're just not making knee-jerk, you know, shooting from the hip responses. We're trying to. I try not to minimize words when talking with Wendy about, you know, data and epidemiology. I mean, we like in my office, we look at the data, you know, and Wendy looks at the numbers, and we extract stuff, and we're looking at all these things, whether as a board or, again, in my office and Wendy's office, all the stuff that we see in the news every day, all these studies that come out or information that comes out, we have to figure out which ones are appropriate and which ones we can apply. And things change. And, you know, it was interesting, you know, how things changed from 2.5 hours, you know, into the meeting, from what we had talked about. But we came out, you know, it was a healthy discussion. So I think the board is thinking about these things. I mean, this is important stuff.
Yeah, definitely. And I think, you know, as you said, it's an ongoing discussion. And as we know, and we've talked about, you know, things keep changing. And, you know, as we look to that May 18th day, you know, what will be happening at that point? And from a Board of Health perspective, what do you think will happen with restaurants and opening of stores? I mean, do we think that's going to happen? Will people have masks on? You know, I'm be interested to see what you think about that.
Let's see, I have my crystal ball. And, you know, we think about this a lot. You know, the governor's order, right, the emergency order, was really initiated to recognize that we have a serious problem. We have this, you know, this disease for which we didn't think anybody has immunity to it. We don't have a vaccine. We don't have treatments. We just have, taking care of people as best we can to get through it. And in order for resources to be made available, Governor signs an order. So that order has unfolded over the past, couple of months. And we're looking to May 18th, but remember, he's closed schools through the end of the school year, right? So that signals to us that there is an expectation that we are not going to be back to where we were, right, at May 18th. I think we have to make sure in what we do, things will not be opened up as they were before. I think the fact that we also the numbers of testing is increasing. I think people are going to get sloppy. I think we're getting, a little anxious, right? And we want to go outside and we want to, and isn't it enough? And I think we have to make sure that we take this in a slow and steady way. There have been published studies on reopening of restaurants in other places where even air supplies, right, that circulate the air, we now know that the virus in its aerosolized form can survive for many, 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 many days, actually. So there are all of these things that we didn't know before, and we're learning because people are now funded to do this kind of research. So some of the work that I'm working on that you didn't ask me, but I'm going to tell you, we work on poop, right? We work on, COVID-19, the SARS-CoV-2 virus in poop. In people who have the virus, it goes into the wastewater. It goes into the wastewater treatment. It goes into our sewers, where our DPW people are working to unclog sewers because people are using wipes and flushing them. So even the people who are working in the sanitary sewers probably should be wearing more protective garb than they already are, right? But so these are the kinds of things that come out. And getting back to your question, you asked me what I think is going to happen. I think it's going to be slow. I think we're going to have to take the precautions. And I think that's what our community would want us to do, is not to just say, Governor lifted order, everything's open. And I think this is a very hard balance between the economics and the health. And, fortunately, I get to think about health. I think that's fortunately. I get to think about health. I think that Mr. Malloy, who has to balance everything, that's very challenging. But I think it will come down to, how will this community look back on this and say, did the board actually sort of take health at its, as its driver? And I think even after we had our meeting on Friday, and I was like, oh, maybe we should have thought about ordering outdoor mask use, and then I'm like, well, but what is the science? It tells us, we still have to separate. We still need the social distancing. And those principles are going to apply even after May 18th.
So just to clarify, the order for the mask is when you are indoors, so, shopping, picking up food, but when you're outdoors and can safely be 6 feet apart, you do not need to.
We are recommending, so the mask is an advisory, right? Okay. That's the difference. An advisory to wear it outdoors, right? But also keeping social distance. And that's a little bit different than if you can't social distance, then wear it. Social distance, we recommend wearing the mask as well. That's where we are. Indoors, and actually even businesses that are not publicly facing or public facing. So biotech companies that are open now because they're essential, other businesses that are deemed essential, offices, etc. People in those places should be protected as well, right? And so masks in there as well.
Right. So I wanted to talk a little bit about your kind of coordination with the superintendent and of the schools of Lexington.
She's amazing.
So as we know, the schools have been closed for the remainder of the year, but as as people talk about where this virus is going to be in the next 12 to 18 months, the cycles moving into the fall, what do you think, and what is kind of the process that the Board of Health and the schools, working together, how will that kind of play out as in these next, couple months looking into the fall?
Yeah, I actually have to say that we haven't taken that on yet. And that is something that we need to discuss. I mean, I look at my day job, and it looks like we will be in a hybrid model, which means that there are some things that we will be doing physically at work, but most of our teaching will be virtual, right? So I think that institutions are weighing, where is the virus? In other words, where's the testing? Does having had the virus once give one immunity, right? So
how do you feel about that, the antibody test? I've heard a lot about false positives. I've heard, that it's a process to order the test, insurance coverage and things like that. Maybe.
So I'm going to turn that over to David, because we have an internal, I'll call it an internal group of two amazing ID docs who are also epidemiologists, and another epidemiologist who we share a lot of material almost on a daily basis. Would you say that, David? Something like that?
Amazing group.
Right. And so David will tell you about antibody testing and the response of this group.
Well, I'll tell you about antibody testing a little bit from my perspective, and then Wendy can fill in the holes if I miss some from the group. But the big thing is how accurate is the testing, and if it is accurate, what does it mean? Because even if you're showing antibodies to, we'll say COVID-19, and then I'll expand on that a little bit. Does that mean you're immune? It means, say you have accurate testing that shows you had it. Does that mean you're immune to it either this season or next season? There are some viruses that you get once, measles, for example, and you're immune for life. There's some viruses you can get once, and you're possibly immune for the season, such as the flu virus, the influenza virus. That's why we need a vaccine every year, because your prior year's infection doesn't carry over. There are some viruses, something called RSV, or respiratory syncytial virus, which is a very common common cold virus, and young kids get it all the time. Some kids just get a bad cold, and some kids get extremely sick. You can get that same virus, and Wendy can correct me, over and over the same season. There is no even short-term immunity often to this virus. And then you have COVID-19, which may be mutating as we speak. So you get it once, even if you were immune to it, are you immune to the next structure of this virus? So the testing is also based on, you really get down to, it wasn't my best course in college, statistics, but you really get down to the sensitivity, the specificity of the tests. Not to break that down too much, is really how good are how, if you're negative for it, how accurate is that, and if you're positive for it. So one of the problems with the positive tests for the immunity, or the immune globulin, I won't even say immunity because we don't even know if you're immune, is that there are other coronaviruses out there, friends, relatives of COVID-19, which can also give you a positive test. So you could have been exposed to one of those and then have a positive test, but was it COVID-19? We don't know that right now. So there is some value if it's positive, knowing that you were exposed to something, and there is some value if it's negative, more likely that you weren't exposed to it or had it. It will say had it, that you weren't affected with it. But then the question is, what does that even mean? Does it mean that you're not going to get it this season or next season? We just don't know that. How's that, Wendy?
That's great. You nailed it. We're not ready for I think we're not ready for using the antibody test for decision making. Mm-hmm. And I think that's what it comes down to, because anytime, like I tell my students, if you're going to test something, you got to think about the reliability of the tests and all the factors that David thinks about, but you also have to think about, how am I going to use that information to make a decision? Mm-hmm. Right? So if you've got so much noise, right, and maybe not so reliable, how could I use that for decision making? So we really are waiting for the, a couple of things. One, of course, is a reliable test that can tell us, was it this virus or its relation, right? That's one important thing. And of course, we probably won't know about immunity until quite some time down the line. But at least getting this specificity piece down is really important, and we're not there.
Well, I think, as we look forward, with the antibody testing, with the contact tracing, and then with this, how do you feel, David, with this new, I'm not going to probably say it right, but this remdesivir, do you see that it's going to have an impact? I mean, a positive impact. I mean, they're saying it's reducing the time, but not, fully.
Yeah, it's another good question. I think that we're still going to find out more information on it. I mean, if there's any positive from it, then that's wonderful. If it can, and I don't know that much about it right now. I'm learning probably as we all go, and probably know as much as you know. Hopefully more by the end of the day. But the question is, how effective is it in decreasing symptoms and preventing significant symptoms? We have these antivirals now that we use for influenza. One's very well known called Tamiflu. And years ago when it first came out, and I don't want to compare the flu too much to COVID-19, but as an example, when this came out years ago, we hardly ever used it because it maybe shortened the duration of the illness by a day or two. And if you really got significant symptoms, it wouldn't really help you that much. But then, if you remember that really bad flu hit, Wendy, how many years ago was that? That really nasty flu came out, and we started using it more and more. Although during that time, again, the infectious disease specialist that we kind of bounce things off of really said, it will help a little bit, but not a lot. And if it's not going to really prevent the really, really bad outcomes. So the question is, where's the value in that? It makes you feel better sooner, but it would really prevent you from getting extremely sick, and possibly not. But now we use it all the time. We use it a lot now because it can help you feel better a little quicker. So that's I think the question with this new antiviral, which I can't pronounce that well. Really, will it make you feel better quicker, or will it really prevent those awful outcomes? But having said that, when COVID-19 came out and they said, the initial information was, for many people it's just a mild illness. I mean, a mild illness meant a really bad flu, and a bad flu, if you've ever had it, that's the reason. Once you get the flu, if you never got the flu shot, you're going to get it next year, because a bad flu will knock you on your butt. So even if this antiviral medicine really helps with any symptoms, it's going to be beneficial, but we just don't know yet.
No. Okay. One of the things that I also wanted to bring up is, I know about the Aloft Hotel. This had kind of come up when I said I was doing this interview. A friend of mine said, ask about the Aloft Hotel. I know that Charlie Baker had designated 4 locations for people that are homeless that have been contracted the COVID-19, and that Aloft was one of them. How is that going? Is it when the numbers are reported, are those numbers included? And where do you kind of see, how long will that location be used for that purpose? Do we know?
I actually don't have that information about how long it will be used. I think that, the necessity to make sure that these folks are housed or placed in a safe place is really important. I'm really thrilled about our town and the chiefs, who once they found out about, that this was designated, stepped up and said, absolutely, we transport like we transport everybody else. And I think we can be very proud in this community, to say, it's not just, a certain, let's say you have to make a certain amount of money to live here, right? But that, this place is here, and we step up and we do our jobs, and these are people who need care. So yes, the Aloft is being used for COVID-19 positive homeless folks. The state provides resources in terms of food, meals and clinical staffing, and I'm actually really proud that it's here.
Good. And the Element Hotel is is it first responders or
I don't know. I think that was discussed.
a different use?
Honestly, I've not heard about that. I know that there are other places being looked at as well. I think we need to just make sure that we take care of, the first responders. They are our first responders, and they have been doing an amazing job. And others have said this, that they've been asked to step up, and the possibility of exposing both yourselves and your families is really, really, really bad thing. And I think, to be able to have places where people can go so that they're safe and their families are safe is just amazing. And I think, this is the reality, that this virus is so nasty that, we are asking people. And, most of them say, what, that's our job. It's our job. Mm-hmm. But we have an obligation to make sure that they are as protected, their health is protected as much as we can do as, public health people.
Yeah, I definitely think the first responders are the heroes in this pandemic. So for people that want to find out more information, I think, from the Board of Health, but also, is there somewhere, if people are in need, is there a fund that Lexington has, for residents, or, let's say people that are at ALOF, for people that can give back, people that aren't on the front lines but would like to do something, what would you suggest?
Right. And in fact, the town does have a fund, and I don't have my finger on, I know that it's on the website. Okay. Sean Dugan, right, who is the PIO, the Public Information Officer, is amazing, and he makes everything available. There is a fund, and excuse me, I just don't know what it's called, but yeah. And there are a number of efforts around food and other resources. I know that the town had also posted the Partners in Health link for people who wanted to get involved in contact tracing. And, I think it's also recognizing the sort of the roles of people who are not on the front lines, right? And all the work that is being done by a whole lot of people in the health world. Because otherwise all this stuff, it wouldn't happen. Mm-hmm. So I think, we think about the public's health, the entirety of Lexington, right? That's our mandate. And there are all these different pockets. And I know that there are efforts to, provide resources to hourly workers, for example, who have been hit hard by this virus. They don't have an option to sit at home like I'm doing and work. And so, I think there are a lot of initiatives. I know that I won't waste your time on this because I can't put my finger on them, but I'll make sure that that Sean is aware that you've asked. But yeah, okay. There are resources available where people
definitely post something on LexMedia. They have a bulletin board that you can put updates.
Right.
So that would be nice to put up there. So David, with your podcast, do you have any exciting new podcasts coming up that we should be aware of or tell our fellow Lexington residents about?
Well, I don't want to self-promote myself too much. We'd like to have Wendy on again, actually, as a circle around. We have a lot of people, so we're doing them remotely now. So Dan Brosco and myself are doing them remotely using Skype, because we can't get into the studio and we're itching to get back. It's a wonderful studio.
David.
No, when it's time.
Okay.
No, we're doing them remotely, so it's actually we've been able to bring in. We've been able to bring in some amazing guests, remotely, and they're willing to come in. So we have I've lining up. We may have one of my good friends who actually is the chief of OB/GYN at Boston City Hospital. It may be on soon. I have some friends who actually work with public health up in Maine, and talking about the situation up there. I actually also a good friend is a nurse practitioner up there. and a former NHL hockey player. So it's kind of a cool hybrid. I'm hoping to have Colleen Smith on at some point as well. No, so it's just we're just having. There's a lot of people. I'm actually hoping to have some. We actually think we're having some teachers on as well, either in Lexington or Bedford, just to see how they're dealing with things. But to me, there's so many interesting people to have on it, even if they don't think that they're interesting. So hopefully we'll have some wonderful guests. I just want to circle back to something Wendy said. About I've learned from Wendy is how much communication, and as you're saying too, Colleen, how much communication is such a big part of public health. With disseminating information. And that's where LexMedia comes in amazingly well with what all you've been doing during this time, and bringing some information, if not some added touch of humanity maybe, and a personal warmth to people's homes right now. Sean Dugan, who's the information on the website, that's such important jobs. To get stuff out there. Even it was amazing. It was really cool to be on that Board of Health meeting with all those participants. I wish they would come to the live meetings when we have them in the future. But there's so much value to this situation, what we're doing right now, and also talking about the people on the front lines. People say to me, I'm on the front line. I appreciate that. I'm seeing kids in my office outside in the parking lot. There's of course you had Joe Simon on LexMedia a week or so ago, a good friend of mine, who's a Newton Wellesley pediatric ER doc. Those people in the hospitals, they're on the front line. The ER doctors, the ICU doctors, the nurses, anybody in the hospital for that matter, right? They have all these people.
Social workers in the hospital.
Everybody.
Yeah.
Everybody who's in a hospital front line. But then you go back to what Wendy said, the DPW people, the people who are working at Stop and Shop, right? I'm going to leave someone out, right? It's the world. The person from UPS that brings the packages to my office. People, who are in the warehouses at Amazon, or whatever. But locally, the people at the Element, right, or a loft. There's so many people on the front line, and everybody's just trying to do their job and to protect all of us. And it's a big deal. And that goes back to when we're talking about the masks. Like, this is a wonderful community, as are many of them around us. We just want to keep people healthy, and there's so many people involved in doing that.
Definitely. Well, I'd like to thank you both so much for taking the time to come on this call. I learned a lot, and I hope people, Lexington residents, have learned a lot. And I'd love to do this again in a few more weeks, because obviously, as we've said, things
will change.
Yeah. And also, as we talked about earlier, LexMedia is doing some great work. As this started to happen, they really kicked into gear. I'm a volunteer, but really the LexMedia staff, directed by Florence and Terry and Rick and Julie and everyone, Ryan, who's at LexMedia, has done an amazing job at this point in time in communicating and keeping us informed, which is great. And I think, I hope people know every Monday, Wednesday, and Friday, they have updates on COVID, and they have, I think every Monday they talk to the town manager, and then every Wednesday and Friday they have different guests all focusing on COVID-19. So it's great. Well, thank you again so much for coming on this call. I really appreciated it, and I learned a lot, and I hope to do this again soon.
Yes, thank you very much for
Thank you very much. Appreciate it.
Have a great day.
You too.
You
Bye.
too.
Bye.